Hi everyone, this is my first YouTube video. I am scheduled for surgery on Wednesday, May 22nd, and that is in just 2 days. Today's Monday. I'm not really sure on the time of my surgery, but I'm hoping it'll be early in the morning. I've never done a YouTube video before, so this is definitely a first. I have no makeup on right now, so I look absolutely horrible. But I've been, I'm having a hard time like looking at the dot rather than looking at myself, but I've been on a liquid diet since last Tuesday. So after today, it'll be exactly 7 days. Um, my doctor originally said that he wanted me to go on the OptiFast diet, which consists of shakes, bars, and a soup, which is, of course, just liquid soup, like no chunkies in it or anything. And I asked if there was an alternative because I am on the lower side of the BMI scale. I am under 40 BMI, but very close to 40. If it was possible that I could maybe skip that and do just a protein shake diet. So they said yes, and they gave me a couple choices. I decided to go to GNC because I have one local to me. And I went in there and I got their they actually offered me a free membership for their gold card. So I get the member pricing. And they had a sale, buy one, get one half off for the protein, the big containers. I bought the chocolate supreme and the strawberry, I don't know if it's strawberry sorbet or strawberry supreme, but the chocolate is very tasty. I mix it with skim milk and some ice, and I use a bullet blender, and it tastes almost like a melted Frosty, which is pretty good. The strawberry, not as good, but you know, it breaks it up to try it. So I've been doing those. He wants me to have like 3 or 4 of those a day, and he said, you know, if you need to, you can have around 6 ounces of chicken, of course, bland chicken, you know, just cooked in the oven, nothing on it, and a cup of either salad with low-fat dressing or a green vegetable. And I've been doing that, and probably, you know, yesterday I had 2 hard-boiled eggs, which are really high in protein. I've actually lost 13 pounds, which is amazing. You know, it's been a week and I've lost 13 pounds. Of course, I was probably eating a lot more those last couple weeks before the protein diet than I normally did. Packed on a couple pounds. So, it's probably why it came off so fast. I'm very excited for the future. You know, it's hard for someone that has never been overweight to understand what it is like to be overweight. And for me personally, I am very comfortable with myself. Like, I'm not shy, I'm outgoing. And overall, I'm a pretty happy person. But I still wake up every morning and the first thing I think of in my head is, yep, you're still fat. You know, every time I get dressed, I look in the mirror 100 times and I'm still fat. Every time someone takes a picture of me and I see it, I'm still fat. So it's been a lifetime thing. I've been dealing with this. Not a lifetime, but like I can remember when I was in elementary school, I never thought I was heavy. You know, I was probably like late in elementary school. I was really skinny until I hit like maybe 13. Or before, I wasn't in elementary school then, I was in middle school. But anyways, around 13 is when I started to get a little bit chunky, you know, and I wasn't that thin little thing that I used to be. And then I moved to West Virginia, and I'd lose some weight, and then I'd gain some weight, plus some back, and I'd lose some weight. And I've done this so many times. Actually, this past year, I started a diet in 2012, and within like 6 months, I lost, you know, 50 pounds almost. And I gained 60 pounds back in the second 6 months of that year. So in 1 year, I lost 50 pounds and gained 60 pounds. That just shows you how I don't have a problem losing the weight. It's just a problem keeping it off. And to lose it, I have to work like a maniac. Like, I have to not cheat on diets. I have to count calories and fat and carbohydrates and do Weight Watchers and go to the gym every day and work like a maniac. And I don't mind doing that, but then I get, you know, then maybe we go on vacation and we have a couple dinners out, and then I get back into the same routine, and it's so easy to fall back into. And I don't want to do that anymore. So this is my choice. While some people might look at me, like most of the nurses and other medical people that I've seen besides my doctors, oh, you don't look heavy enough to have this surgery. Oh, you're not that overweight. Well, you know what? I am. You know, my insurance approved it. I feel it. My family, you know, is supportive of me for the most part. So this is what is happening. As far as my medical problems, I had horrible triglycerides, horrible cholesterol, and severe obstructive sleep apnea. I sleep with a CPAP machine. So hopefully after the surgery, not only will I feel better about myself and be more comfortable in my own skin and in clothes, I'll actually have less medical problems. And you know, the way I try to explain it is, I know a lot of people that are older than me, 20 years older than me, and I look at pictures of them when they were my age or a little bit younger, and they're so slim and so skinny. And now they're very overweight, even more overweight than I am. And I feel like if I'm starting this big, imagine what I'm going to be like 20 years from now. And I want to be around to see my kids grow up and get married and have their own kids, and my grandkids get married. And I don't want to live on this path anymore. So this is my choice. What else do I want to talk about? It's really hard, especially when you have kids. You think about, you know, there are definitely risks, and you feel like, are you being selfish doing this? And I don't feel like I'm being selfish. I feel pretty confident in my surgeon, which is Dr. Kakalaya, and I feel like this is going to prolong my life, and it's going to make my energy level higher, which is going to make my kids happier, and I'll be able to do more with them, and I won't get tired out easy. So this is what I'm going to do, and so I'm really excited. I plan on probably having my husband bring the computer to the hospital, so I can do a blog after the surgery. I'm really nervous about how everything's going to go because you read so many things, and some people are like, oh, it was fine. Some people are like, oh, it was terrible. I haven't had a lot of things in my life. I had 2 babies. One of them was a C-section, so I have had a C-section, and it was pretty easy, except for the fact that I live in an old Victorian house with 3 floors, so going up and down the stairs was a little bit of a problem, but I'm thinking since it's going to be laparoscopic, it'll be a little bit easier. The plan is tomorrow, I'm going to be on all clear liquids. I'll be able to have water, Crystal Light, sugar-free Jello, and some broth, which I tried some broth. I don't think I'll be having that. Maybe if I get desperate, but it didn't taste too good to me when I didn't have to drink it. So tomorrow they'll call between 2 and 6 and give me my time for Wednesday. I'm under the impression it's going to be very early because I was told that at the time of scheduling, I was the first one on the schedule, and if he schedules more, I'll be the first one because I was the first one to schedule. So I'm assuming probably be there around 6. I'm hoping. I was told the surgery would take an hour and a half. I'd be in recovery for an hour, and then I'd go to my room. There, I'll not drink or eat anything by mouth for the first day. So that's going to be interesting. I think probably the pain medicine will make me not think about eating or drinking. They said bring lots of chapstick, I've read online, so plan on using that because I'm sure my mouth will be pretty dry. And the next morning around 10 a.m., they'll take me downstairs to give me an upper GI barium swallow test to make sure there's no leaks. If there's no leaks, they'll send me back up to my room, and they'll start me drinking a very small amount of water. And as long as my body can tolerate it and I'm not vomiting and I can get it down, I'll be leaving the hospital the next day on Thursday. So I'm looking forward to it, and I plan on keeping everyone updated, and I hope I'm not talking too much because I really don't know what to say. I've been watching these YouTube videos, and it really helps me out a lot because, you know, I do know a couple people have had the procedure, and I've tried to ask them, but they're like, you know, they had the surgery a couple years ago, so they're probably sick of talking about it. They're like, God, if one more person asks me a question about this vertical street sleeve gastrectomy, I'm going to lose it. So I feel like I'm bugging people when I ask them. So it's been good watching YouTube videos and, you know, getting information. Even though it seems like everybody's progress and everybody's recovery is different. So I really won't know until it happens, but I hope that I'm able to help someone out that has questions. I haven't given a lot of details on the process to get to the surgery. So if anybody has any questions about how the insurance worked for me, the process of getting all of the testing done to submit to insurance, or has any questions in general, just send me a post and I'll try to answer your questions. And thank you very much. And I don't even know if I said this, but my name is Heather. I'm from Jersey. Okay, have a nice night. Thank you. Bye.